All right, there we go. Thank you everyone for coming. It's a wonderful turnout. Just want to talk about some of the Asian Chamber of Commerce, some of our programs that we have on a monthly basis for our members and for the community. We have our business essential workshops, which are held every month. And right now they are also virtual through Zoom, and they are there to provide support for owners, business owners, and entrepreneurs. Just yesterday, we did one on creating a business plan, and we did post that on our Facebook, so it's there for you if you didn't get a chance to join. We also have member mixers that are going on every month. In fact, I'd like to put a plug for our one from March, which is a special Hong Kong opportunity with a delegation from San Francisco and Chicago coming in and doing a panel talking about opportunities in Hong Kong, and we're going to have a lot of fun. And those member mixers are an opportunity to network and build your business portfolio, your business network of friends. And today is the Women's Club, and I think I am the ugly duckling in this wonderful, beautiful group of women, which has been championed and led so well by Stephanie. And with that, I pass it on to Stephanie and our speaker for today.
Thank you so much, Mark, as always. I'm going to introduce our speaker today. It's my pleasure to introduce Dr. Vani Vallabhaneni, and I apologize if I butchered the pronunciation, but she is the founder and medical director of Sleep 360 Sleep Diagnostic Center. She is clinical assistant professor of medicine at Texas A&M University and a co-investigator in a NIH-sponsored clinical study related to mild cognitive impairment and sleep apnea. She completed her residency in internal medicine from University of Texas at Austin, Dell Medical School, and completed her training in sleep medicine from the School of Sleep Medicine in Palo Alto, California. She is board certified in internal medicine and sleep medicine. She's a delegate of Travis County Medical Society and serves on various committees at state level with Texas Medical Association. She volunteers her time in local nonprofits and serves on school boards. So today she's going to talk about sleep and its health impacts. So please welcome Dr. Vani.
Thank you, Stephanie, for that kind introduction. Can you all hear me okay? Okay. So it's my great honor and pleasure to present for women's group of Greater Austin Asian Chamber of Commerce. Recently, we had International Women's Day. Congratulations to all for being part of this group. And today I'm going to talk about sleep and its health impacts. So I'm going to share my screen and let me know once you see it. Are you able to see it? Okay. All right. Thank you. So a short disclaimer before we start. This information that I'm providing today is for understanding sleep health and should not be used for diagnosis or treatment. If you're having any sleep symptoms or problems, please consult your physician and do not share any of your personal health information. So the objectives for today's talk is to understand the normal sleep-wake cycle that we go through every day, and followed by I will be discussing about 2 common sleep disorders, and I will conclude this today's talk by understanding the importance of sleep and healthy sleep habits. So the sleep-wake cycle that we go through every day is controlled by processes in the brain. One is the homeostatic drive for sleep, which controls and promotes sleep by producing what we call as GABA, or gamma aminobutyric acid, which is an inhibitory neurohormone. And the wake promoting portion of the brain is controlled by the circadian drive, and it promotes wakefulness by secreting hypocretins. So light is a potent stimulus for promoting wakefulness, and it increases the production of hypocretins. Under dim light and dark, the pineal gland produces melatonin, which inhibits the production of hypocretins. So the sleep promoting portion of the brain takes over and we fall asleep and stay asleep. So this happens every day This is how the brain controls the sleep and wakefulness in our body. So several factors affect the production of hypocretins, such as stress, any physical health condition can affect and increase the production of hypocretins, and that takes over and decreases sleep. So people suffer from several sleep disorders because of that. So this two-process model, which is the homeostatic drive promoting sleep and the circadian drive promoting wakefulness, they work very closely hand in hand. As we stay awake throughout the day, the alerting signal increases in strength by production of hypocretins. So it increases and it helps us stay awake 16 hours every day. So as that happens, the sleep load also builds up in the homeostatic drive. And at the time of sleep, there is a sudden dissipation of the alerting signal. So the sleep promoting portion of the brain takes over and we fall asleep. I hope this process is clear to you. This is important to understand several factors that affect our sleep. So what are the various sleep stages? So when we study sleep, we divide sleep into various stages. One of them is called REM sleep, or rapid eye movement sleep. That is also called dream stage of sleep. And the non-dream sleep is further divided into stage 1, 2, or 3, also called slow wave sleep. So when we examine what affects the stages of sleep across the spectrum, the studies have shown that age is the strongest determinant factor about how much time we spend in various stages of sleep. As we grow older, there is a significant drop in the slow wave sleep, as we see. There's a maximum reduction in slow wave sleep that happens in the second decade of life by almost 40%. The slow wave sleep is highest in young children, and it decreases by 40% in second decade of life. It has been shown that in men beyond over 60 years, there's a significant drop in slow wave sleep compared to women. Women tend to maintain slow wave sleep longer into older age. Versus REM sleep, or the dream stage of sleep, is well maintained even into old age. Okay, slow wave sleep is the restorative sleep. During this stage of sleep, the sympathetic nervous system is less in activity. As a result, the heart rate, the blood pressure are lower, and that is protective to the cardiovascular health. And it is also a very restful stage of sleep. REM sleep is when the dreaming occurs, and whatever we learn during the day, it is consolidated and stored in memory. Memory formation happens in REM sleep. So in patients with brain dysfunctions, their REM sleep is affected and their memory can be affected. The other thing that you want to understand is wake after sleep onset. How much time a person wakes up in the middle of the night increases as we grow older. We see that in older population, they wake up multiple times throughout the night, and this wake after sleep onset can increase with age. The other thing that you want to understand is sleep latency. The time it takes to fall asleep also can increase with age. There are certain changes that happen even in adolescence. We see that in our children. There is a 2-hour shift in the sleep-wake cycle because of the decreased release of melatonin in this age group. As a result, the homeostatic drive for sleep slows down, so they are not able to fall asleep at the usual time that they used to fall asleep when they were in elementary school or middle school. So we often see the high school children sleep at a later hour, but also there are environmental factors and evening light exposure which can affect sleep. And because of the earlier school start times and the excess activity or out of extracurricular activities or school homework, they are not able to get the amount of sleep that they need. There, they need 9 hours of sleep and they may be getting just 6 or 7 hours of sleep. As a result, they build chronic sleep debt, and this can affect their health. And studies have shown that by delaying the school start times, the total sleep time and the depression scores have reduced. So total sleep time increases and the depression scores can reduce in adolescents. The next, I would like to discuss the importance of sleep. Why do we need sleep? So sleep is essential for survival. Several studies have shown that in animals, sleep deprivation results in early death. Repeated exposure to sleep restriction changes the physiological processes in our body. Okay, even after substantial time is allowed for recovery, total recovery is not seen. So we need to pay attention to the total sleep time that we are getting every day. Adults need 7 to 8 hours of total sleep time. In America, in US adults, about 37% are short sleepers and about 2 to 3% are long sleepers. Both are associated with high mortality rates because it results in impaired glucose tolerance and also increases the ghrelin levels and reduces the leptin levels. Basically, it affects the cardiovascular health, increasing the risk for cardiovascular disease, diabetes, and also increases the risk for obesity. In addition to that, it affects our immune system. It increases the inflammatory cytokines that we produce, and it reduces the antioxidant defense responses in the body. As a result, there is an imbalance in the inflammatory response and decrease in the antioxidant defenses in the body, and this results in cell injury, causing several chronic health conditions. Long sleepers are associated with depression, low socioeconomic status, undiagnosed medical conditions, poor physical health, and low physical activity. Next, I'm going to talk about 2 common sleep disorders. So we in sleep medicine, in sleep clinic, we treat several sleep disorders. Primary sleep disorders are many, as you can see, and we also address chronic sleep deficiency. So today I'm going to talk about obstructive sleep apnea and insomnia, which are 2 primary, very common, very prevalent sleep conditions, and chronic sleep deficiency. About 1 in 3 Americans suffer from chronic sleep deficiency, and an estimated 20% of US workforce are shift workers. This results, as I discussed before, results in physiological changes, neurobehavioral changes, and that can lead to chronic health conditions. So obstructive sleep apnea is a condition when the upper airway gets blocked when a person is sleeping. The person is totally unaware of it, but it not only affects the patient or the person, but it also affects the bed partner. And we often see that the bed partner or the wife or the spouse always makes the appointment because even their sleep is getting affected. So what is the prevalence of sleep apnea, obstructive sleep apnea, especially in US adults? It is estimated that 29 million US adults suffer from obstructive sleep apnea. When we say that they stop breathing or struggle to breathe 5 times or more per hour. Only 20% of them are diagnosed, 80% of them remain undiagnosed. So that is the gravity of the problem we are dealing with. That is how prevalent it is. So what is obstructive sleep apnea? What happens when we sleep? So when we sleep, the muscles in the body relax. Like any other muscle in the body, the tongue is a muscle, it relaxes. The soft palate and uvula is a muscle that relaxes. And the posterior wall muscles in the posterior part of the airway, they relax. So in all of us, the airway gets slightly smaller when we sleep. But in patients with obstructive sleep apnea, The tongue relaxes much more. They have much more soft tissue here. As a result, the upper airway collapses either completely or partially, resulting in blocked airway, and the air is not able to enter the lungs intermittently throughout the night. When this happens, the oxygen drops in the blood. The brain cells sense it because brain cells are highly dependent on the oxygen to survive. And they make the patient wake up. So the patient may wake up gasping for breath or coughing or clearing their throat. So those are all the signals that the brain is saying, hey, come on, wake up, you need to breathe. And the person wakes up with those symptoms. So the upper airway opens up and they're able to get the breath in. But this repeats itself several times during the night. As a result, they do not get restful sleep at night. So how does sleep apnea affect cardiovascular health? So when they are not able to breathe well, it causes disturbances to sleep. We call them as microarousals, decrease in oxygen, increase in carbon dioxide, and these changes in the pressures of the chest cavity, all of them affect the nervous system. That results in increase in clotting factors, and that increases the risk for stroke. They also affect the electrical system in the heart. As a result, they increase the risk for cardiac arrhythmias, and that is a risk factor for death. So what happens if we do not treat moderate or severe sleep apnea has been shown to be associated with they are prone to developing hypertension, high blood pressure 1.5 times more than normal controls, increased risk for diabetes, stroke, heart attacks, cardiac arrhythmias, increased risk for death. So it's very important to treat sleep apnea once we diagnose it. So patients with high blood pressure, obesity, cardiovascular disease have high prevalence of sleep apnea. American Academy of Sleep Medicine has estimated that nearly $150 billion is the economic cost of undiagnosed obstructive sleep apnea. It is because of workplace-related accidents, motor vehicular accidents, low productivity, and increased risk for comorbid diseases. So what are the signs and symptoms? I explained a few of the signs and symptoms before. At nighttime, the patient may experience the symptoms of snoring, gasping, snorting, choking, coughing, witnessed apnea by the bed partner. They may be restless sleepers. They experience excessive night sweat, excessive nighttime urination, or even bedwetting. During the daytime, the patients experience excessive daytime sleepiness, fatigue, lack of energy. They may wake up with headache, dry mouth, memory problems, inability to focus, mood problems, irritability as well. So when we examine these patients, upper airway is normally visible when they open the mouth and relax the tongue. But in these patients, we are not able to see the upper airway. So how do we diagnose obstructive sleep apnea? We do sleep studies in the sleep lab. We place various sensors that measure various physiological parameters. We also offer at-home sleep studies where the patient is able to place the at-home sleep study kit. And after that, we analyze the data and we classify the sleep apnea into various severities of sleep apnea. We classify them as mild, moderate, or having severe sleep apnea based on number of times they stop breathing every hour. So if they stop breathing 5 to 14 times every hour, we call them as mild sleep apnea. Moderate is 15 to 29 times per hour, and severe is greater than 30 per hour. In children under 13 years of age, the classification is slightly different. So once they are diagnosed with sleep apnea, we offer them various treatment options. You might have heard about CPAP, also called continuous positive airway pressure therapy. CPAP is a small device that sits on the nightstand, and the patient wears a mask that fits them well, and that's connected via the tube to the machine, and the machine is delivering room air at a certain pressure to keep the upper airway open. That's all it's doing. So you can consider this as a natural way of treating the condition. Then there are other treatment options available for mild or moderate sleep apnea. Dental appliance, also called oral appliance, done by a dentist who is trained in sleep medicine. They take an impression of the teeth, come up with a custom fit device, and they will adjust it by which the lower jaw is moved forward. That opens up the airway behind the tongue and the patient is able to breathe in and out. The other treatment options, Bongo RX is like a one-way valve. This goes into the nostrils. When they breathe in, they get a full breath in, but when they're breathing out, it holds some of the air behind the tongue to keep the airway open. This creates a suction force called INAP, and because of the suction force created in the mouth, the tongue is held on the roof of the mouth. This is called Excite OSA. It's an electric stimulating device. It is used during the day for 20 minutes, every day for 6 weeks. After that, once a week. It is used to tone the tongue muscle, and it is only indicated for mild sleep apnea. And body positioning belt is indicated for positional sleep apnea, when they have sleep apnea only when they're on their back. So it helps them sleep only on their side. So there are several surgical options also available to treat sleep apnea. Inspire device is a newer technique where the ENT physician puts a pulse generating device under the skin on the right side of the upper chest area. It has 2 electrodes. One is a sensing electrode, senses when the patient is attempting to breathe, and it transmits that information to the stimulating electrode, which stimulates the tongue muscle, and it moves forward instead of falling back. As a result, the airway is maintained open during the night. So we have learned that by treating sleep apnea, we can help control diabetes better. It reduces the risk for cardiovascular disease. It reduces the risk for mortality and hospitalization in heart failure patients, improves control of blood pressure, improves the cardiac function, reduces motor vehicular accidents, and improves quality of life. Now we are going to talk a little bit about insomnia, which is another highly prevalent condition. So insomnia is highly prevalent in US adult population. About 1/3 of US adults have experienced insomnia at some time during their life. It can present as difficulty falling asleep, staying asleep, waking up earlier than desired. In addition, they should be experiencing daytime symptoms such as fatigue, excessive daytime sleepiness, mood disturbances, irritability, lack of energy, poor concentration, memory impairment, frequent headaches, frequent stomach aches, or even behavioral problems such as hyperactivity, aggression, or impulsivity. During this pandemic, we have noted that 75% of patients with COVID infection have experienced sleep disturbance. Sleep insomnia has also been increasingly noted in healthcare workers and even in general population. So this sleep-wake difficulty that they're experiencing should not be caused by any other sleep disorder. And it is noted that insomnia is common in women, older adults, people who experience stress, and people with certain medical or mental health conditions such as depression. So there are 2 types of insomnia based on the duration of the symptoms. If they experience the symptoms less than 3 months, we call it as acute insomnia. If the symptom duration is longer than 3 months, we call it as chronic insomnia. Nearly 10% of US population experience chronic insomnia. So this is how a patient who is predisposed to developing insomnia progresses to develop symptoms, and that progresses to develop chronic insomnia. So what happens? There are certain people who have biological traits, psychological traits, or certain social factors which puts them at high risk for developing insomnia. But they develop the symptoms during certain stressful life event, or if they're experiencing any mental health condition or medical illness. So then they manifest the symptoms of insomnia that I just described. But if such a person starts developing habits such as spending excessive time in bed, they nap during the day, or they develop other behavioral conditioning, then it progresses to chronic insomnia. So when we see patients in the clinic with insomnia, we examine for all these factors. We try to correct and change the behaviors which are acting as perpetuating factors. We address their medical and mental health conditions and try to help face the stressful life event so that they can go back to a state where they're not experiencing symptoms. So insomnia is basically a clinical diagnosis. We look at their sleep diary or sleep logs that they maintain. We sometimes need a sleep study to see if they're having any other sleep problems other than insomnia, which can exist in addition to insomnia, and address that. So how do we treat insomnia? Cognitive behavioral therapy has shown to have strong success rate in treating insomnia. Brief behavioral therapy is a brief version of it. And there are other ways to treat insomnia, which have shown to be helpful, such as massage, medications, a weighted blanket or weighted eye mask. Insomnia therapy device is a device which basically has a coolant circulating through this, and the patient puts this on the forehead, a mask on the forehead. It has been seen that in certain patients, there is a high brain activity in the frontal cortex, which is right behind the forehead. By cooling the temperature of that part of the brain, reduces the mental activity, mental chattering going on, preventing them from falling asleep. And this helps to address that. So cognitive behavioral therapy is when the patient is seen for 4 to 8 sessions, during which we educate the patient about the sleep health, and we address various behaviors that are not conducive to sleep. So I conclude today's talk by discussing about healthy sleep habits. So remember to keep a consistent sleep-wake schedule. Wake up at the same time every day, no matter how you slept the night before. Don't go to bed unless you're sleepy. If you're unable to fall asleep after 20 minutes, get out of bed and go to a different room. Do something uninteresting or boring under a dim light. And when you feel sleepy, return to bed. Have a relaxing bedtime routine. Make sure you limit the exposure to bright light in the evenings and try to turn off the electronic devices at least 30 minutes before bedtime. Okay, so regular exercise and healthy diet also help promote a good sleep. Reduce caffeine intake in late afternoon or evening, and avoid consuming alcohol before bedtime, and reduce fluid intake before bedtime. So we have learned that sleep is essential to health, equally as important as good nutrition and adequate exercise. A third of our life we spend in sleep, so might as well take care of our sleep. Sleep is considered particularly important for learning and memory, and also has implications for emotional health and behavior. Sleep apnea is a cardiovascular risk factor. So together we can reduce morbidity, mortality, and healthcare costs by treating sleep disorders. Thank you for your attention, and I can take any questions you may have.
Thank you so much, Dr. Vani. If anybody has a question, please feel free to put it in the chat box, or if you'd like, you can take yourself off mute, just raise your hand, and so we're not all going at once. I have a question actually. So my husband uses those glasses to block blue light because I've told him just don't be on your iPad like when you're going to bed, but he can't do that. So he uses these blue light blocking glasses. Are those shown to like work? Because I've tried them and I don't think they work, but I don't know.
Yeah, so blue light is emitted by the electronic devices, as we know, and in that wavelength, it can reduce the production of melatonin. That's the pathway how electronic devices affect sleep. So the blue light emitted by the electronic devices, cell phones, computers, laptops, TVs, they reduce the production of melatonin. As we learned in the first few slides, melatonin reduces the production of hypocretins, because of which the sleep promoting portion of the brain takes over, and that's how we fall asleep. So if we do not reduce the use of electronics 30 minutes before bedtime, it's going to affect the amount of melatonin that we have in the body, and that's going to affect the quality of sleep we get and how much time we take to fall asleep. So regarding these blue light blocking glasses, I'm not very sure. There are no clinical studies documenting their relationship to the amount of melatonin being produced in the body. So it may be a placebo effect at this point, or it may be, if it is blocking blue light, that wavelength. And so we have to do some clinical studies to see how much melatonin is being reduced, or not being reduced by these blue light blocking glasses.
I am currently suffering this insomnia. Until today, it's been like 3.5 weeks. I normally, in the past, I have like once a month, once a year, like 7 days maximum. But this time it's been more than 3 weeks, and I just, hard to fall asleep. And then once I sleep, it's, hard to stay asleep. So some nights I can barely get like 1 hour sleep, but still not solid. The first couple of weeks, I just tried not to take any medicine. And then after that, I just couldn't stand anymore. So I took the prescription from my doctor, that trazodone. And so if I took one and the next day, I have, pretty much side effects, like, druggy and tired and headache. And so I asked my doctor to give me another one. And he gave me this Biosummer or something. I don't know if you have seen this. I just tried this. He gave me 3 doses, like 10 milligram. I tried the first night. I was able to sleep like 5 hours, and then on and off. And then last night was the second time I tried this 10 milligram, and I did not sleep until probably 4, and barely got like 1.5 hours sleep. So what's your suggestion here?
Yeah, so I think, as I mentioned, I would take a detailed history, which I don't want to do it here in this platform, but I would need to take detailed history. I would need to look at your sleep logs, which is the sleep-wake schedule that you're maintaining. I need to look at what are the underlying conditions because of which the symptoms appeared. And if you're having any habits or behaviors that are perpetuating this insomnia, so I will start right there and see if there's any cognitive behavioral therapy that can help improve your sleep-wake cycle and treat insomnia. So if after implementing that, in addition to that, if in some patients, I'm not sure in your case, if we need to take the help of sleep aids. So we may or may not have to do that for a brief period of time. So in my practice, I start with cognitive behavioral therapy, give it a good chance before deciding a sleep aid. In some rare cases, we do a combination of sleep aid and cognitive behavioral therapy. And once that is shown success, once the patient becomes independent and is able to maintain a good sleep, then we taper the sleep aids and see if they're able to still maintain good sleep. So that's where I would start. So I'm sorry, I don't want to take a detailed health history right here, but that's what I would suggest.
I have a perfect health condition, no any other problems. Very healthy. But I think maybe it's the age. I just turned to 59.
No, I mean, I would not just go with the age. As I said, I would need to see if there are any stressful life events that have contributed to the symptoms. Anything changed in the recent past? I would focus on your sleep-wake schedule, your work schedule, your emotional health, your relationship health, your social media. So there are a whole lot of things I need to evaluate and take into account and try to see what can be done to improve health, and then see if you need sleep aids, what is the best sleep aid for you. So there are different sleep aids that can be used, and I cannot treat you on this platform unfortunately. I'm sorry about that.
Yeah, so should I contact you after?
Yes, ma'am, you can contact my office and we can go from there.
Thank you.
Thank you.
Have there been any clinical studies done where you look at melatonin increase after a period of using or stopping the use of screens with regard to age groups? Is there a change? You threw out the number 30 minutes is a sufficient length of time, but is there a change between age groups where you needed longer amount of time to restore melatonin production?
Good question. So the recommendation is actually 2 hours. I put 30 minutes there. I didn't want to put a number actually. So the recommendation is actually 2 hours. So it takes that much time for the melatonin to build up. But people are so much addicted to electronic devices, the cell phones, they just don't want to leave it. It's almost like a part of your body now. So it's almost difficult to put it away. So at least start with 30 minutes. And once you start feeling better, getting good sleep, I'm sure I would say the addiction or the time you want to be with your cell phone or electronic devices reduces. And, I think it becomes easier then. Start with 30 minutes. So regarding the clinical studies, 2 hours is the recommendation from the clinical studies. Across the age also, there are studies that have shown that with age, there is reduced production of melatonin. So it's okay. I mean, I know the use of melatonin has gone up in the recent years. So people are consuming more melatonin. There could be some side effects in some people from melatonin, so you need to watch out for that. Over-the-counter melatonin also is not FDA regulated, which means the availability of melatonin, what is advertised on the package, may be very less or too much, and it may vary from tablet to tablet within the same package because it is not FDA regulated, the ones that are available over the counter. Yeah, I think that's what I can say about what you asked.
Additional question with regard to that. Have they shown differences in melatonin reduction based on whether it's a handheld device versus a TV screen?
Yeah, so there are studies which have shown that electronic devices which are more interactive versus passive electronic devices, such as TV is considered a passive electronic device versus a computer or a tablet or a cell phone where you're actually playing games or video games where your mind is interacting with the electronic device. In those type of situations, the brain actually has what we call as cognitive arousal. So there is increased production of hypocretins, which causes cognitive arousal, and that overrides the homeostatic drive for sleep, and they may suffer from difficulty falling asleep. You're welcome.
Hi, I have a question, and since this is a women's group, I thought I should use the M word, menopause. I'm wondering if menopause interferes with your sleep cycle.
Very good question. Thanks for asking that. So yeah, menopause, as women know, that it can be associated with sweating or hot flushes and several other symptoms. And also there are changes in emotional health, and also, it can affect behaviors. So because of the hormonal imbalance that happens at that time, and that can definitely affect sleep. So they, especially insomnia, so they experience difficulty falling asleep, difficulty staying asleep. And that would be another question for our audience member who just asked about her sleep condition. So menopause definitely can cause insomnia, can affect the quality of sleep we get. And it's important, if a person is having severe menopausal symptoms, to get it treated, because if it goes on for a long time, they can develop chronic insomnia. So it's important to address that.
And I have one more question. If a person, let's say, sleeps at, let's say, 9:30 and wakes up at 6 o'clock in the morning, that's a good, healthy sleep routine because they get a solid 8.5 hours. Is that different from a teenage kid sleeping at 4 a.m. and waking up at 12:30 because they still might get their 8 hours or 9 hours of sleep? Are both those sets of sleep the exact same in terms of benefit?
Good question. So as I mentioned, in adolescence, there is a shift in the sleep-wake cycle by at least 2 hours. So if when they were in middle school, if they were able to fall asleep, say at 10 o'clock, now they're only able to fall asleep at 12 midnight because it takes that much longer because of the slowing of the production of melatonin, and the homeostatic drive for sleep slows down at that age group. But as they go into in their 20s or 30s, it becomes more regularized, like the adults, where the production of melatonin happens at the usual time, and then they're able to fall asleep and stay asleep. So regarding the quality of sleep that they get, say 4 a.m. to mid-noon, like 12 noon, versus so this is what we see in adolescents. Because of the school start times, during school days, they may be going to bed, say midnight or 1 o'clock or 2 o'clock, and because they have to wake up at a certain time in the morning. But on the weekends, they take the liberty of being with their electronics or friends on electronics, interacting with friends, whatnot, and they go to bed even later and wake up later. So we call this as social jet lag. And this does affect how this does affect their quality of sleep the following week. So it is a vicious cycle, and they do not get the same quality of sleep that they would if they maintain the regularity to their bedtime and wake time. And this we see even in adults, not just adolescents, but even in an adult, because of their social situation, they are sleeping, say 1 or 2 or 3 hours later on Friday or Saturday night, and then they switch that time to an earlier time because of the work schedule. This is what is social jet lag. This creates the circadian clock that maintains and tries to entrain our biological clock, tries to entrain our sleep-wake cycle to the outside environment, which is the light and dark cycle of the day. It's trying to constantly entrain our biological systems to the outside sunlight and night. So that gets disrupted. They go out of sync. So they don't get the same quality of sleep. And it also affects the production of melatonin eventually, and it affects both how they function. The homeostatic drive and the circadian drive, how they coordinate things to entrain it to the outside sleep-wake cycle, it gets disrupted. The other thing I wanted to mention was when we sleep, the brain is trying to clear out the toxins that it has accumulated during the day. So we see the effect immediately. Even one night of poor sleep or short sleep, we see the effect immediately the next day. Why do we see that? Because the brain is not able to clear the toxins that it has accumulated during the daytime. So it is during sleep, that's when the brain is trying to clear out all those toxins. This is a new research that has come out that has been shown that this is how it can increase the risk for dementia. So if we do not get enough sleep, there is increased risk for dementia eventually.
I have a question. You mentioned like melatonin over the counter is not FDA approved. And this makes me think about the younger kids. I feel like when we were kids, nobody mentioned taking any type of melatonin. But now I have a daughter that's in preschool, and I look over at my friends or acquaintances, and they said, by 9 or 10 o'clock, they give their kids melatonin to put them down. And I'm like, wait, what? I have a nephew that's only 4 or 5 years old, and their mom's like, yep, right at 8 o'clock, I just give them melatonin and they go right down. And it's really hard for me to process that. I feel like if my daughter's up, that means she didn't do enough activity or brain stimulation for the day. So tomorrow I'm going to do more activities or whatever it is. What are your thoughts on giving kids melatonin?
I mean, I am not a proponent of that. Of course, I want to let you know that I'm not a child sleep specialist. So I treat adolescents and adults, but this is what is going on in the society. There are a lot of societal pressures, and the parents are, working really hard, either 1 or 2 jobs, there is not as much extended family support that we got when we were growing up, or our parents got when we were growing up. So there are a lot of societal pressures. There are a lot of social media peer pressures that adolescents and middle school children are dealing with, or college kids are dealing with. So it's really important, to educate our young parents, because I think it's important it starts with education. Anything and everything starts with, creating an awareness, creating an education channel for this. And I would really encourage if school boards, someone from school boards can take on sleep as a topic to be included in their curriculum, just like, we talk about several, chemistry, physics, and biology. So it can be easily introduced as a little chapter where kids understand the importance of sleep. And of course, with that, the parents would understand. And when those high school kids go on to college, they are more well prepared. Now we see a lot of, societal chaos because of so much going on in the social media or outside world. Everything does affect our emotional health, and which in turn affects our sleep health. The other thing I wanted to let you know was how stress affects sleep. So when we experience stress, we produce more hypocretins. And that is the same pathway, how it overrides the sleep promoting portion of the brain. So that's how it affects. So it's important for all of us, adults, kids, to practice relaxation techniques on everyday basis, because during the daytime, we have several experiences, right? Interacting or doing our work or whatnot. Children do have these experiences, but how do we process those experiences? How do we convert those experiences into neutral or positive experiences is by relaxation techniques. So this is another thing I would suggest school boards to introduce in their curriculum to teach children relaxation techniques. And that promotes good health, good emotional health, good mental health, and they will be more successful in life.
Thank you.
Any other questions?
Dr. Vani, would you just let us know, if anybody has a concern about their sleep and wants to reach out to you, what's the best way to do that?
Yeah, so I can share my website, or they can go to www.sleep360md.com, and they can make a request from there directly, or they can call us at 512-810-0360.
Perfect. Thank you so very much for sharing your knowledge with us today. I know it was really insightful and helpful in terms of just learning about different sleep issues. I know sleep is so important, especially, I think we're all over 30 here, except maybe Joy. So we're all knowing the essentialness of sleep and how when you don't get that good night's sleep, everything just falls apart. But thank you again so much. We really appreciate you. And I think we are ready to go into breakout rooms if Mark has them ready for us.
I want to take a moment to thank all of you for such a nice interactive session. I really enjoyed interacting with you, talking to you all. Thank you very much for giving me this opportunity. Thank you, Stephanie, for reaching out to me, and thanks, Mark, for coordinating everything.
Thank you, Dr. Vani, for your presentation. And I will end the recording now for the group, and we will break out into groups.